Here we have 5 to 8 students are there, and our primary HOS Miss Sulba Puja is there, and the program coordinator Miss Ramya, and all some teachers also have joined.
Okay. Thank you, sir.
Okay, sir. Well,
I would like to thank Mr. Anas, who is the principal, for inviting me, and also Miss Sulba Puja, who's the head of session, and Miss Ramya, who is my batchmate also, for inviting me to this session. Am I audible now? Okay.
Welcome, sir.
yes, it's clear. Yeah.
Okay.
Students, you have to respond to him. That's why he's asking that audible or not. So that response will help you.
Okay, sir.
They will do it, sir. Sure.
So I'm going to show you a small PowerPoint presentation. So in this COVID-19 time, curriculum and continuing the academic activities as previous before COVID era. We are changed to digital screens. So all teaching activities, all academic activities are in front of the screen. So that definitely increase the eye strain, headache, watering, and so many other issues. So I will show you a small PowerPoint presentation how we can reduce the eye strain and eye fatigue.
Okay, sir.
Can you see the screen now?
No, sir.
Not yet.
Can you see this now? Screen?
No, sir.
Okay. Just a minute. Okay, just a minute. Now?
Yes, sir, we can.
Yes, sir.
So most of the time when you use screen for a long time,
Sir?
so okay,
I can't see the screen.
Sir, I can see.
Okay, now we can.
okay, thank you. So
It's visible. It's visible for all.
okay.
Yeah, now we
So
can.
most okay, thank you. So most of the time you use screen for a long time, you have eye strain, headache, blurred vision, dry eye, and neck and shoulder pain. These are the most common problems we face when you use the digital screen. So, so if you feel these issues like eye strain, headache, blurred vision, then you are suffering from digital eye strain or computer vision syndrome. So the older name was a computer vision syndrome. Now we usually call it as digital eye strain. So we have to face this syndrome because when you are working in a computer for home or school or work more than 2 hours, then most of the time you will be suffering from these issues. Computers and smart digital devices have brought so much enrichment to our lives with increasing the productivity, especially this COVID-19 time. The problem is that this digital age has come to put a greater stress on your eyes. So our eyes can't tolerate such close activity for hours. As a result, computer vision syndrome or digital eye strain has become a very common problem. So it is a physical discomfort after 2 or more hours in front of a digital screen. So most of these symptoms are, one is a redness, irritation or dry feeling of your eyes. Second one is blurred vision due to a screen glare. Third one is general fatigue, malaise fatigue from staring at screen for a long time. Fourth one, you have neck pain, back pain due to a poor body posture. And last one is the headache. So why this symptom happens? Because one issue is that because of poor lighting. Second one, glare on the digital screens. Third one, improper viewing distances. Fourth one, poor seating posture. Uncorrected vision problems. Usually we are more concerned about this blue light and excessive light energy from these digital devices. You know our visible light spectrum. So we have which are like violet, blue. These are the wavelength, low wavelength. So this band of the blue violet considered potentially most harmful to eyes. So that is around 415 to 455 nanometers. So these spectrum are most used in our digital screens. So that wavelength of light can cause more harm to our eyes. So computers, sunlight, TV, light, cell phone, tablets, all these have more blue light spectrum. So this blue portion of these digital devices can cause more eye strain. So is it always harmful, this blue light? No, it's not always harmful. It's normal, essential for a normal circadian rhythm, normal sleep, normal alertness, memory, normal sleep cycle. But overexposure, especially at night hours, can used to disturb in our sleep rhythm, affect the normal sleep cycle, causes eye strain, headache, etc. So I am going to give you some tips how to relieve, how to get relief from this eye strain. So this is a tip to reduce the digital eye strain. Can you hear me now?
Yes, sir.
Yes, sir.
Yes,
Yes,
sir.
sir.
Oh, thank you. Okay. So, if anyone of you are using glasses or anyone of you having some defective vision, you feel you cannot see as clearly as before, then get a comprehensive eye examination. Just do a eye checkup and make sure that you are using a correct spectacle or correct contact lens and correct any refractive error. There may be myopia or long-sightedness or hypermetropia, that is short-sightedness, or astigmatism. These are the common errors that we are using glasses. So check your eyes and correct the glass which we are using. Okay. Second one, in the room we are using for online classes, use proper lighting. When you use a computer, use ambient lighting. Should be about half as bright as typically found in most of the offices. It should not be bright as exteriors. So you can use minimum light from the exterior sources, but eliminate excess light from exterior by using blinds or curtains, etc. Reduce the interior lighting by using normal lights and do not use high bright lights, etc. If possible, position your computer or monitor screen close to windows, to the side of the windows. So you can see in that picture, like this way you can, light should enter the room, but it should not from behind the screen or behind the sitting position. Ideally, it should be from the side of your room. Okay. Second one, adjust your device display settings. So whenever you use a computer or a laptop or a tablet or something, so adjust the brightness of your display so that it's approximately same as the brightness of your surrounding workstation. That means it should not be too bright or it should not be too dim. So when you take a white page, so it should like in the second picture, it should not be so bright like a very glossy appearance, or it should not be so dim. So ideally display settings in your computer should be in a moderate level. So first one we discussed, the brightness in your room. It should be ambient and it should not be high or low. Second one, display settings in your tablet or digital device. Third one, adjust the text size and contrast. See, you can see 4 pictures here. The first one is ideal. black text on a white background is better. Others, they can cause more strain to your eyes. Fourth one, color temperature. Especially if you read night time or you reading for a long time, so set up in the device so that blue light is less used and reducing the color temperature give you a better long-term viewing comfort. So this one set to light mode, so you can see better comfort in the second picture. Okay, this one is the normal mode, and this one is the better for long-term reading purpose. This is the ideal one. Blink more often. Whenever you are using a screen or whenever you're reading, automatically you will blink less. So blinking is very important when you're working at a computer. Blinking causes moistens the eyes and prevent dryness and irritation. So whenever you're working in a computer, blink rate is less in frequency, amplitude, etc. So normally an ideal person will blink 20 to 25 times in a minute. When you are using a computer or digital screen, it will be like 5 to 6 times. So whenever you use the mouse click or whenever you use enter or pause button, etc., always try to blink. So you remember like that way. Whenever you press mouse, whenever you press enter, blink one time. So frequent blinking will increase the moistening of eye. That will cause more soothing effect to the eyes. So tears, our tear film is coating the eye. So whenever it's evaporate, you will have this dryness, burning sensation, pain in the eyes. So increase the blinking, and when you are severe symptom of the dryness, you can consult an ophthalmologist and eye doctor, and he will prescribe you this type of drops. So these drops are actually artificial tears or tear supplements. So these drops will help you in more moisten your eyes. And this is the golden rule for decreasing your eye strain. That is 20-20-20 rule. So whenever you're working in a computer, for every 20 minutes, at least for every 20 minutes, you have to look at a distant object that is at least 20 feet away for at least 20 seconds. So every 20 minutes, look at distant object for at least 20 seconds. Then you can concentrate on your screen. It's because actually our eyes are designed for distant vision. Nowadays, you are using eyes only for near vision, for reading, so your outdoor activities are very less now. So most of the time, you are using our eyes only for a reading purpose and near vision purpose. So to reduce the strain, always try to look for distance for at least for 20 seconds. Then you can concentrate again on your devices. Do not see a screen or a device more than half an hour in a stretch. Take breaks, look for a distance. So always make a point in your room so that you can just defocus and see that point for some time, for 30 to 30 seconds. Then again, you can concentrate on your studies. Okay. Other one, take frequent break. Whenever you feel discomfort, just breaks, just stand up, move around, stretch your arm, leg, break, neck. Then you can just wash your face, and then continue your online activities. Then modify your seating posture, because improper posture can cause headache, neck pain, eye pain, etc. So ideally, your screen should be at least 20 to 24 inches from your eyes. That means at least 50 centimeters from your eyes. And center of your screen should be little lower to your eyes. That means your eye level should be little higher than that screen level. So your eyes will be less exposed to the lights. You should not always take care that your eye level is always higher than the screen level. never overuse the digital devices. If you can avoid using at least the last hours before sleeping, try reading books instead of digital screen when possible. So these are the some of the tips that you can help us that helps us to reduce the digitalized rates. Other one, some people use screen protectors and some people use glasses to reduce the eye strain. That also can be possible if you are not comfort with these tips. Thank you.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank
Thank
you,
you, sir.
sir.
Thank you, sir.
Thank you, sir.
You can ask questions from sir.
Okay.
One by one, please.
Sir, like,
Yeah.
how much is the time like we have to um watch the screen a day?
See, ideally, it depends upon your class schedule, your online work, etc. So whenever you are using more than 4 hours, that will cause eye strain.
Like continuous.
Yeah, definitely. More than 2 hours definitely can cause eye strain. So, in because of this COVID issue, you have to attend class for long time. So, take adequate breaks in between. So, whenever you are seeing a screen more than 20 minutes or 30 minutes, just take your eyes away from the screen, look for some distant object, then see the screen again.
Okay,
Always
sir.
try not to look screen for long hours and increase blinking. Keep on blinking in between.
Okay, sir, can I ask a
Yeah,
question?
definitely.
Yeah, sir, what's the maximum amount of screen time we should watch or play or just look in a day? Maximum.
See, ideally before COVID-19 time, you usually advocate not more than 2 hours because
Yeah,
nowadays because of the class, this assignment, you may have to
yeah,
work
there's
more
4 hours
than
in
4
that.
hours. It's okay up to 4 to 6
Yeah,
hours. But the
okay.
most important thing is that
But then sometimes some people like after class they watch or play for another 2 hours, so it
yeah,
becomes like 6 hours.
that's the issue. That's the issue. These works you have to after the class, other assignments, maximum possible you do with the paper, with the books, etc.
So
After the
after class, don't watch TV or phone for any time.
yeah, that's not possible actually without watching
Yeah,
TV. So
yeah,
minimize the
I do that myself.
digital devices use after the classes.
Okay,
Minimize.
sir.
Sir,
Thank you, sir.
Yes, Amanda.
so may I ask a question?
Yeah, definitely.
Today we are totally reliant on these digital devices because we are having online programs and then
Yes,
sometimes even
yes.
for entertainment. So how what can we do to stop us looking at it too much?
So definitely when you are seeing for a long time, you will have some eye pain, you will have some eye strain, some burnings, etc. So I'm asking you a question. How many
Yes,
of you?
I have felt all the symptoms.
So then you are suffering from this digital effect. So basically, how many of you are suffering from any of these symptoms? Can you just raise
Sir,
your hands?
I suffer from two:
Okay.
watery eyes and irritation to my eyes.
How
Nothing
many
else.
others? How many
I
others?
feel I like burning eyes and watery eyes both.
Okay.
Sir, I have dry eyes and a bit of shoulder pain. Sometimes, a bit. Only a tiny bit though. But I
Okay.
dry eyes I have.
Okay.
I feel headache and blur.
Students, once you have addressed, lower your hand, please. Amanda, Adi.
Yes, ma'am.
Sir, I have a question.
So I think
Yes, Malang.
most of you are suffering from any one at least one or two symptoms. That's because recent increase in the screen time. So ideally, we cannot during class time we cannot reduce the use of the digital devices. So what we can do is one thing, adjust the screen brightness adjust the room brightness, maintain correct posture. Fourth one, take frequent breaks, look at distant object in between. Next one, increase the blinking. And if you're suffering from more dryness, you can use these artificial tears, drops. That helps to maintain your tear film, maintain the eye health. And in your diet also, so increase the green leafy vegetables, increase the, if you're eating fish, increase small fishes. And if you are eating nuts, you can add walnut, etc. That all are important for eye health. So green leafy vegetables, all these dietary things you can add. Take more water, drink more water. So all these things helps. And if you are suffering from any decreased vision or any defective vision, you can check your glasses and correct the glass and reduce the extra time after the class in a
Actually,
digital
I
So,
device.
have to change my power, but the thing is that now as there is coronavirus, we are waiting for it to calm down a bit, and then we are going to go.
Okay, can do like that and just
Mana,
for some time.
Mana, you can ask your question.
Yeah, definitely.
So, which is better? Like, if we remove our specs and look at a distant place, or if we wear the specs and look at a distant place, which is better?
So you have, if you are using glasses, look at distant object with the glass only. So you will be seeing more clearly with the glass. So using the devices time and even using looking for distant object, always try to wear the glass.
Thank you,
Nada,
sir.
so
Nada.
Does looking at a smaller screen like on a phone is different from looking at a larger screen like on a TV?
That's definitely true. It's one of the most important. You missed that point actually. So it's always better to look for a larger screen. So better to see in a projector or than a laptop screen than a tablet than a mobile phone. So whenever screen is larger, your eye strain will be less. So whenever possible, use larger screens because mobile screens are producing maximum problems to eyes. So better to use tablet or TV or this laptop or a projector if possible.
Like
sir,
Yeah,
sir,
yeah,
like you told that after 20 minutes we have to look at a distant object, right?
yeah.
But when we are playing like video games, we will like forget about that.
That's true.
So what can we do?
Take a pause, look, and then your initial times. I usually tell my patients, students, etc. So what you have to do, keep an alarm, like alarm every 20-25 minutes. Just it ring for 1 second. You can just keep in mind that you have to look for you have to take a break. So after 1, 2, 3, 4 days, you will be used to it. So initial days, you can keep an alarm for that.
Okay, sir. I have one more question, but this is not about digital devices.
Okay.
Like, if we read like a book,
Hmm.
um, more than 2 hours will irritation will come to our eyes.
That can come because actually our eyes are designed for viewing a distant object. To see a near object, we have to use our 4 muscles. We have 6 muscles in each eyes. So to see near object, we have used continuously using our muscles, eye muscles. So whenever you use screen or reading for a long time, you will have eye pain. So reduce that. Take frequent breaks. Look distant object for in between, and just wash your faces. So these things will help you in reducing the strain.
Okay, sir. Thank you, sir.
Okay.
Dr. Irshad, I would say that though we are going on with our classes, we do have 10 minutes screen off time between the two periods. We have allotted
Oh,
that 10 minutes.
okay, okay. That's very good, madam.
We we done that. And obviously, it's not non-stop 40 minutes also, because children are working with their notebooks, they're looking at the screen, and some of them don't even join on time. So it's not non-stop for 40 minutes. But yes, we have kept that thing in mind. So we have given them 10-minute screen off time in between.
That's great, madam. That should be addressed for all students actually. That's great.
Anyone else has the questions?
Hello, sir. Hello.
Hi. Hi.
So what is actually circadian rhythm? Can you just explain?
So normally we have all people, all human, we have a rhythm in our brain. See, that's controlled by some hormone like serotonin from in our brain. So we have like 8 hours sleep time, 8 hours working time, 8 hours rest time, like that way. So that's a normal circadian rhythm. So when you use this device more in the night, especially when you off the room light, just seeing the device light only, so that can actually confuse your brain. So brain will think, oh, it's daytime. So because excess blue light is coming, so that will alter the sleep pattern, normal sleep pattern. So that's why we are telling, never use mobile screen or any screen, especially in the night time.
Something against a biological timing? That's what you mean?
Yeah. Against our biological time.
Okay. Then, which is the most soothing color for our eyes? For example, in operation theaters and all, they are using green color mostly.
Green
So,
color.
is there any color like that
Yeah, we
which
should.
is most soothing for our
Actually,
eyes?
actually, we say green is the most smoothing color because in the visual pattern, green is almost in the mid range, right? Violet, blue comes in the lower spectrum, yellow, orange, red comes in the other spectrum. So green comes almost in the middle part of the spectrum. So usually we say green is most smoothing color in the eyes, smoothing color in the eyes.
So, as you said, after 20 minutes to a children to just gaze at some distant object.
Yeah,
So, rather than gazing at any random thing, will it help if we could gaze at something like scenery or something which have more green color or something like that?
actually the idea is to defocus the eyes. So it's better to see a distant object. The green is okay. Whenever there's a window there, you can just look outside. It's okay. It's good. The idea is that
Okay.
to defocus the eye.
Okay, sir. Okay. Thank you.
Sir,
Yeah. Adi.
when we watch the screen for a lot of time, after finishing watching, we feel very tired to our eyes.
Okay.
Why is that coming?
That's because you are watching for a long time. Definitely
But
that.
we are sitting, right?
Yeah. When you are sitting, you are using your brain. So that actually will consume most of your energy. You are using your eyes, so that also consumes energy. Using your brain. So it's not just physical activity, it's the mental activity that is causing the fatigueness.
Okay, sir.
So the ideal thing is that limit the timing. Even though you are sitting, your mental work, your brain activity, everything requires energy. So all activities can be done in a limited period. So that's why all we tell all those students or patients every time, you can use mobile phone, you can use your digital devices, you can use computer, laptop, everything, you can use gaming, no issues, but should be limited. Every activity should be limited in a particular time. Should not be exhaustive or should not cause a fatigue to the person who uses. Okay.
Sir, I previous students, I think all of them have asked the questions. Okay.
Okay.
Any more questions?
Yes, Anjisha, you want to ask any question?
Yes, ma'am.
Okay, all have done with it, or any more questions left?
Can I ask a question?
Okay.
Sir, I used to rub my eyes and my eyes used to be like small and red. What can I do for that?
Anjisha, please be louder.
Sir, can you hear
Okay.
me?
Yeah, I can hear you.
I used to
Understand.
rub my eyes and my eyes used to be like small and red. What can I do for that?
It's because of maybe because of the ocular allergy. So we have these allergen particles, allergens in our home, outside, everywhere, etc. So the most important thing you should wear a protective glass, or you should not expose your eye to allergens. So whenever you clean the dust, when you clean your curtain, etc., make sure you are protecting your eyes. Second one, you should not rub your eyes. So whenever there's an allergy, we will tend to rub your eyes. So that can cause eye redness, that can cause increase in the allergy, pain in the eyes, etc. So if you have allergic symptoms, you have to reduce the exposure to allergen. Second one, you can use some anti-allergen drops. You can consult a doctor and you can use some anti-allergen drops so that you will not have this redness, itching or pain. Third one you can do, you can use cold compress. Just use some ice or ice pack, something that you can keep in the front of your eye. So that will reduce the itching. Okay.
Okay, sir. Thank you, sir.
Excuse me, sir, I have a question. So, sir, the
Okay,
symptoms
then,
you
dear
have,
children, I think all have done with it.
so, today,
Yes,
ma'am,
ma'am.
I'm
Sasna, ma'am, you have anything
yeah,
to speak?
yes, yes. So, I have all that symptoms, and I consulted the doctor, and I am wearing the glasses. I have drops for the dryness, redness, everything was there
Okay.
for me. But still, after even I am using the glasses, I am having the problems.
Okay.
That means getting headache and all. I am now also I am suffering some of these problems because long hours of working. Yesterday itself, I can say I was mainly I was with the lab itself most of the time. Up to till night and also is it if you are using glass we can completely got free of all these symptoms, is it possible? Because I am suffering again, that's why I have a doubt on it.
That's true, madam. Even though you are using glasses, you will not be get rid of that symptoms because of this work pattern. It's actually reduce the frequency. That's the only thing. You have to do other things like see all of us are not prone to this problem. So at least 30 to 40% of the people are more prone to this eye strain and digital eye fatigue because already they will have a minimal dry eye disease. On top of that, when you look for a screen for a long time, these people will have more symptoms. So basically, these people who are prone will have minimal dry eye disease already, and this is accelerating because of the screen use. So you have to use these drops correctly. You can use the spectacle. You can use other methods like other tips what we have mentioned. Together, all these things
Sir, I have a doubt.
you can reduce the frequency of these problems.
Sir, I have a doubt.
Yeah. Tell me.
Sir, when we use a device,
Okay.
when we are using a device in a day and comparing it to when we are using a device at night, when it is the when we are using it at night, it causes more damage to our eyes and brains. Why is it like that? It's like the brain does not.
Two reasons. One, the surrounding light. Surrounding light in the room differs in day and night. Daytime, usually in our room, there will be some sunlight, there will be some tube or some light in the room. So there will be ambient lighting in the room. So that itself can cause decreased problem in the eyes. Second one, in the night time, we may be using only the lights and sometimes we use off the lights. So both these conditions, whenever there's an increased light in the room or decreased light in the room, can cause more harm. Second one, the circadian rhythm. So we have this normal sleep, work, rest rhythm. So when you use screen in the night, that can hamper the our normal sleep rhythm. So that is to decrease sleep time, decrease in the sleeping cause fatigue, headache, etc. So it's better to reduce the screen time in the night.
Thank you, sir.
Okay.
I think it's over. Okay. Okay. So I think all of them have cleared their doubts. Yes.
Yes, ma'am.
Thank you. So wonderful session it was.
Okay. So on the behalf of Health and Fitness Club of the Oxford School, I thank Dr. Irshad for obliging us by taking out time from his busy schedule and giving all of us a deep insight into the topic. Thank you so much, sir.
Thank you, Ramya. It's a
I would
nice
like to thank
experience.
our principal, Dr. Anas, thank you so much, sir. Primary HOS Ms. Sulba and pre-primary HOS Ms. Meenal for giving an opportunity to the Health and Fitness Club in organizing this webinar. Indeed, the need of the hour. Thank you so much.
Thank you, Ramya.
So, thank you, sir. It was truly informative. So, can we all wind up, sir?
Yeah, definitely.
Thank you, Dr. Shah. Thank you, teachers. Thank you, dear students.
Okay, dear student, you can just wind up the session. You can just.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir. Thank you, sir.
Thank you, sir.
Thank you, sir. Bye, sir.
Thank you, Shah.
Bye, sir. Ma'am, should we leave now?
Yes, please. Thank you all.
Bye, ma'am.
Thank you,
Bye,
ma'am.
ma'am.
Bye, ma'am.
Session over. Session over.
Okay.
Bye, ma'am.